Anticonvulsant medication for the Nclex. As usual, we start with a quiz. A client has a prescription for valproic acid, 250 milligrams once daily. To maximize the client's safety, which time is best for the nurse to schedule administration of the medication? So I'm going to evaluate, and I know that valproic acid is an anticonvulsant that causes central nervous system depression and has this side or adverse effects that include sedation, dizziness, ataxia, and confusion. When the client is taking this medication as a single daily dose, administering it at bedtime negates the risks of injury from sedation, and this also enhances client safety. Otherwise, if I had that option, I would have given it after meals to avoid GI upsets, but I don't have that. So number 4 is my correct answer. So remember, if the client is taking a CNS depressant, you want to inform the client that sedation can occur, and you want to educate the client on measures to ensure safety. So some anticonvulsants we need to know for the Nclex include your phenytoin, which is Dilantil. It also includes phenobarbital. So we have our phenobarbital here. There's also valproic acid. There's carbamazepine or your Tegretol. And there's also clonazepam. So these are some anticonvulsants you need to be aware of. And remember, they work by depressing abnormal neuronal discharges in the central nervous system. They work by suppressing abnormal electric impulse through the cerebral cortex. And they can raise the seizure threshold, or they may work by altering levels of neurotransmitters. So again, they are used for seizures, to decrease the incidence and severity of seizures. Most times, the client may require more than one anticonvulsant to control their disorder, and treatment is typically lifelong. Anticonvulsants could also be used in treating neuropathic pain, so you want to take note of that. What are the side effects? We talked about CNS depression, where we said you could have sedation, dizziness, ataxia, and confusion in the client. Remember, ataxia describes that lack of muscle control or coordination of voluntary movements, such as walking or picking up objects. You could also see respiratory depression in your client. We could see aplastic anemia. So this is a rare condition in which the body stops producing enough new blood cells. We could also see gingival hypertrophy. This usually occurs with phenytoin. So there's gingival hypertrophy, which is an overgrowth of gum tissue around the teeth. So you can see that overgrowth of gum tissue around the teeth. You could also have nystagmus. Nystagmus is a vision condition in which the eyes make repetitive, uncontrolled movements. And these movements often result in reduced vision and depth perception, and it also can affect balance and coordination. These involuntary eye movements can occur from side to side, up and down, or in a circular pattern. So you're going to have that blurred vision as a result of that. We could also see lethargy, and again, we could also see GI upset with phenytoin or Dilantin. In terms of our nursing consideration, you want to educate the client that phenytoin can discolor urine. It can also discolor sweat to this pink or reddish color. So you don't want to mix this medication with other drugs or dextrose. We want to implement seizure precautions. You don't want to discontinue this drug abruptly. Monitor serum levels. Remember, most anticonvulsants have very narrow therapeutic range, so you want to monitor serum levels. You also want to monitor CBC because of that risk of aplastic anemia we talked about. Remember, your white blood cell count should be between 4,500 to 11,000 cells per microliter. Your red blood cell should be between 4.5 million to 5.9 million cells per MCL for men, 4.1 million to 5.1 million cells per MCL for women. So you want to monitor CBC. The client needs to avoid alcohol. They need to avoid alcohol as well as other CNS depressants, as it can increase serum levels of the anticonvulsants. So use caution with medications that lower seizure threshold, such as your MAO inhibitors, your tricyclic depressants, and your phenothiazines. So you want to use caution when you're already using drugs that also lower the seizure threshold. And educate the client that tolerance can develop with long-term use of this medication. So it might have to be changed over time. So you want to educate your client on that. And you want to be cautious because of interactions that could occur with these drugs. For example, barbiturates, which are used to treat seizures, like your phenobarbital, your sodium thiopental, your pentobarbital. They can actually stimulate the metabolism of other medications that are metabolized by the liver. Also, phenytoin, which is an anticonvulsant, is highly protein bound. So you could have drug interactions with this particular medication. It's very, very common because it's highly protein bound. Also, you want to administer per oral with at least 1/2 of glass of water or with meals because of the GIT upsets that we talked about.